name is Intradermal. Today I'm gonna be performing the intradermal injection. Um, Here I have my supplies, my patients, my syringe, medication, alcohol pad, hand sanitizer, gloves, and gauze. First I will check the provider's order, then I will check the 6 rights, which are right patient, right medication, right dose, right time, right route, right documentation. Okay, next I will check the EHR with the doctor's order. The doctor order says tobacco 5 TU per 0.1 ml. So with the days of calculation, I'll be giving my patient 0.1 ml. Okay, so that checks with Ma. So I'll gather all my supplies. I'll enter inside my patient's room, knock knock knock, close the curtain for privacy, perform hand hygiene. I'm gonna introduce myself to my patient. Hi, my name is Nkeo. I'm gonna be your nurse for today. May I please have your full name and date of birth? I verify my patient using two identifier, which is correct. Do you have any allergies of food, medication, or environmental allergies? My patient doesn't have any allergies. Okay, Mrs. Me, today I'm gonna be giving you an injection. Okay, this injection is called tobacco. Okay, the injection is checking to see if you have tuberculosis, if you've been exposed to tuberculosis. Okay, and some of the common side effects of the injection are swollen and itching of the site. Okay, when I'm actually giving you the medication, you may feel a slight burning or stinging. Okay, that is very common with all injections. Okay, but with the adverse side effects are shortness of breath and hives. Okay, but if that happens, let me know immediately. Okay, do you have any questions for me? Okay, my patient doesn't have any questions for me. So what I'm gonna do next is I'm gonna perform hand hygiene. I'm gonna put on gloves. So next thing I'm gonna do is I'm gonna clean the top of my medication. Okay, I'm gonna clean it with alcohol swab. I'm gonna dispose of this. I'm gonna clean this with alcohol swab. I'm gonna dispose of this. I'm gonna leave this to air dry. While this is dry enough, this is my syringe. This is 1 ml syringe. 1 ml syringe. 25 gauge, 5 by 8 inch needle. Okay, I'm gonna open this up. I'm gonna dispose of this. So I'm gonna draw up 0.1 ml of air. Okay, I have drew up 0.1 ml of air. So I'm gonna gently tuck up the top, put it by the side. I'm gonna insert it to the inside the valve. By the time everything is dried up already, so I'm gonna gently insert it inside the valve. I'm gonna push in the 0.1 ml of air. I'm gonna put it by the side, and I'm going to draw up 0.1 ml. Okay, draw up 0.1 ml. When drawing up, I make sure there is no bubble and nothing, everything is good. Okay, when I see bubble, if there is a bubble, I'm gonna tap to get rid of the bubbles. Okay, I'm gonna gently draw up 0.1 ml. I'm gonna take it out. Okay, everything looks good, no bubble, 0.1 ml. So I'm gonna do 1 hand scoop. Okay, I'm not gonna touch it. 1 hand scoop. I'm gonna close it. I'm gonna come closer. I'm gonna show it to you guys. I don't know if you can see, this is 0.1 ml. There you go. There you go, 0.1 ml. So I'm going to keep this by the side. What next I'm going to do, I'm going to pick the site of the injection. Okay, when picking the site, I'm gonna take out my 3 fingers, would do 3 fingers about 3 to 4 fingers below the intercubical space, or I would do like a hand wide of the wrist. Okay, so this is the site of the injection that I'm going to be giving. Okay, now I have my site, the site of the injection. I'm going to look for if there is any discoloration, any redness or inflammation. Then I'm going to palpate. Okay, I'm going to palpate, make sure that there's no tendernesses, that everything looks good. Okay, like I said, everything looks good. My patient, the site looks good. There's no tendernesses, there's no discoloration. Okay, so what's next I'm gonna do is I'm going to take off my gloves. I'm gonna take off my gloves. I'm gonna perform hand hygiene. I'm gonna put on new gloves. So what next I'm gonna do is I'm going to clean the site. Okay, with alcohol swab. I'm gonna clean the site with alcohol swab. I'm gonna clean from the center. I'm gonna clean from the end center and the side and rotate around. Okay, 5 cm 2 inches. Rotate around. Make sure everything is clean properly. I'm going to dispose of this. I'm not going to touch the inside. I'm going to let it to dry on itself. Okay, so when it's drying up, I'm going to I am going to take off the top of the needles. I'm going to hold it bevel up. I'm going to bevel it up, hold it like a dot. With my non-dominant hand, I'm going to tie the skin. Okay, with the bevel up, I'm going to put it in 5 to 15 degree angle. Okay, 5 to 15 degree angle, about 3, go in about 3 millimeter. Okay, I'm gonna go in about 3 millimeter. I'm not gonna go in too deep. Then I'm gonna stabilize. When it's stabilized, I'm gonna use my non-dominant hand, I'm gonna hold it, okay, and I'm gonna push in the medication. Make sure everything goes in properly, okay, slowly and properly. When I'm done, by the time I'm gonna see well, or I'm gonna take it out slowly. By the time I'm gonna see a well or bleed, okay, or kind of a mosquito bite, okay, I'm gonna dispose of this in the sharp container. I'm not gonna recap. I'm gonna use the gauze and put it on top of my patient. I'm not gonna massage it. Okay, I'm not gonna massage it. I'm gonna make sure that it's not bleeding, but even if it's bleeding, I'm gonna apply bandage, but it's not bleeding. I'm not gonna massage it to the area, okay? Then make sure everything looks good. I'm going to dispose of this. I'm gonna dispose everything to the trash. I'm gonna dispose everything. I'm gonna take off my gloves. I'm gonna dispose of this. I'm going to perform hand hygiene. I'm gonna make sure my patient is comfortable. Do you have any questions for me? Are you comfortable? Is there anything I can do for you? Okay, my patient doesn't have any question. My patient is comfortable. I'm gonna give the call light to my patient. Okay, in case if you need anything, let me know, okay? And I will go and document. By documenting, I will make sure that I have the right patient. I document the right patient, the right medication, the right dose, the right time, the right route, the right documentation. I document everything, the right site. If my patient have any advice effects when the medication is given, if anything is, in fact, I will document everything. Okay, thank you very much.